Jess Brown-Fuller.
Thank you, Mr. Stewart. It's a pleasure to serve under your chairmanship. Welcome to the chair. I'd like to begin by thanking my honourable member, the member for Bath, for securing today's important debate and for her tireless work over 6 years as the chair of the all-party parliamentary group on eating disorders. She has been a consistent and compassionate advocate for better awareness, better services and better outcomes for those affected. I'm also pleased to see the Minister's sharp elbows here in the chamber today, as pointed out by the member for Hayes and Harlington. Eating disorders are among the most serious and complex mental health illnesses. And as the Honourable Member for Salford pointed out, it is estimated that over 1.2 million people across the UK are living with an eating disorder today. And tragically, eating disorders carry the highest mortality rate of any mental health condition. But instead of stepping up to meet the scale of the crisis, services are being cut. The statistics are shocking. In 2023, the proportion of 11 to 16-year-olds with an eating disorder had risen five-fold from 2017. And among 17 to 19-year-olds, the rate had surged from 1.8% to 12.5% over the same period. Girls are disproportionately affected, with rates 4 times higher than boys, although we are seeing a concerning trend of more males suffering with eating disorders, as highlighted by the Honourable Member from York Outer. And as my honourable friend from Edinburgh South West said, numbers across the UK have risen dramatically since the pandemic. But behind each of those numbers are young people whose lives, education and futures are being taken away from them by this illness. At the same time, hospital admissions for eating disorders have doubled over the past decade. Yet the national treatment targets, which were set in 2019 under the previous Conservative government, which were 95% of urgent cases seen within 1 week and 95% of routine cases within 4 weeks, were they later dropped by that same Conservative administration under the 2024-25 National Priority Mental Health Objectives or Success Measures. And this has not been reintroduced by the current Labour government. So this is a moral failure and it must be reversed. Instead, most areas in England are planning real-term cuts to eating disorder provision, and as many members have highlighted, of the 42 integrated care boards across the NHS in England, 24 are projected to reduce their spending for under-18s in 2024-25 once inflation is factored in. And the Royal College of Psychiatrists has warned that even current levels of funding are too low to cope with the rising demand, so cutting further will only make this crisis worse. We must understand the true cost of inaction. Eating disorders strip people of their health, their relationships, their adolescence, and in too many cases, their lives. And still, so many people are being told that they are not thin enough to receive care. And I am very grateful to the Honourable Member for Camborne and Redruth for reflecting his experience and the experience of parents across the UK that are waiting for their child to hit an arbitrary target on a scale to suggest that their mental health is bad enough to get the help that they so desperately need. We know that early intervention is effective, but if people are not believed or are not seen as ill enough, they are left to deteriorate until that crisis becomes a tragedy. And this crisis is also being compounded by the influence of social media and online platforms. And as the Honourable Member for East Wiltshire told us, it's a crisis of modernity and the increased societal pressures on our young people. Recent research by the Centre for Countering Digital Hate found that algorithms on platforms like YouTube are actively recommending harmful eating disorder-related content to young users. These are not passive platforms, they are powerful tools that are shaping the mental health of our children, and they must be held to account. I do not identify as a young person anymore. My children definitely do not identify me as a young person, but I see it on my algorithms, where I actively seek out body positive profiles, and yet what appears on my feed is people telling me that I can lose weight in 28 days or, you know, shape yourself for summer. And our young people are seeing this all too often and thinking that that's the norm. So we as Liberal Democrats believe that addressing this crisis requires a bold and evidence-led strategy, and that means building specialist support into the NHS, not as a niche service, but as a fundamental part of mental health care. It means embedding early intervention through mental health hubs in every community so that young people can access help long before they reach crisis point. We are calling for mental health checkups or a mental health MOT at key points in people's lives when they are most vulnerable to developing serious illnesses. And we believe every school should have a dedicated mental health professional so children can get support early in a familiar environment without stigma or delay. Lastly, we must also recognise the crucial role of families. Unpaid carers, parents, siblings, partners, children are often left to navigate a fragmented and under-resourced system alone. And as the member for Harlow mentioned, the government must work with carers, not against them, to expand the support that they need and deserve. No parent should have to fight for their child to be taken seriously. And I saw that in my own patch of Chichester when a mother had to leave work for 2 hours every day to go to her child's school, to sit in a room with them so that they were supported throughout lunchtime so that they could eat their lunch, because the school could not facilitate a member of staff to sit with that child who was tackling a very serious eating disorder but was desperate to stay in school. Campaigners like Hope Virgo have done an extraordinary job of raising awareness, but it should not always fall to campaigners and grieving families to fill the gaps left by government inaction. And I join my honourable friend from Bath in calling for the exploration of an eating disorder national strategy. Mr Stewart, this is a national crisis and it is costing lives. The government must listen to those on the front lines, the patients, the carers, the clinicians and the campaigners. They're not calling for sympathy, they just want action, and we owe it to them to respond. Thank you.